Good afternoon, ladies and gentlemen. My name is Nirav Shah. I'm the director of the State of Maine Center for Disease Control and Prevention. I'm delighted to welcome everyone this afternoon for a discussion on education matters. I'd like to turn things over to Governor Mills.
Thank you, Dr. Shah. And happy Friday, everyone. Thank you, everyone, for joining us this afternoon. Looking forward to a great weekend, a good weather weekend. And with the school year fast approaching, really just a few weeks away for some people in the county, for instance, we wanted to take this opportunity this Friday afternoon to discuss the administration's approach to supporting our local schools and their officials in considering whether and how to resume in-class instruction this year. First, I want to turn things over to Pender, Makin, Commissioner of Education, to discuss the challenges students, teachers, and school districts have been facing over the past couple of months and how the Maine Department of Education has been working to prepare for the coming school year. Pender? You're on mute. She's on mute, I think.
Sorry about that.
All right.
So when schools switched to remote learning in March, our nation's public education system faced some of its greatest challenges of all time. In Maine, school and district leaders were forced to make extremely difficult decisions, and teachers had to completely redesign their practice, setting aside carefully developed plans in order to learn new skills and strategies for engaging and educating their students from a distance. Parents became supervisors of kitchen table classrooms and took on the demanding roles of learning coaches and facilitators. At the Maine Department of Education, our child nutrition team immediately began helping school nutrition programs by obtaining federal waivers and providing technical assistance to facilitate the provision of healthy meals to students in need throughout the period of remote education. Our content specialists offered daily office hours throughout the spring to provide professional development, technical assistance, and live consultation for educators, parents, and caregivers. Topics included remote instructional strategies, providing remote special education services, addressing the social, emotional learning, and mental health needs, as well as emergency preparedness and response. Within the first week of this emergency situation, the DOE team recognized that a lack of internet access provided barriers to educational continuity for many students. Governor Mills took swift action in allocating resources from her governor's emergency education relief funds to support cellular data contracts for 100% of the nearly 24,000 students whose needs were reported. Throughout the spring, our team collected concerns, ideas, and priorities from Maine parents and caregivers, educators and students who participated in focus group sessions, trainings, and consultation events. Our department experts who support other programs like CTE, Career and Technical Education, Adult Education, English for speakers of other languages, and Special Education, brought their findings from additional targeted discussions and trainings to inform our framework for the safe reopening of schools. This framework also includes input from health officials, educators, school leaders, and other experts at DOE, and it's intended to inform the plans that will be developed at the local level for the safe return to in-person instruction. We released our draft framework last month, and we've continued to seek input through a series of surveys developed by an independent research group. We received 44,000 responses, more than that actually, and the researchers have begun reviewing the data. Initial findings show that most teachers, 78% of them, intend to return to the classroom in the fall. Most of them, however, are worried about their own health and about the health of their students. 83% of parents reported that their children are eager to return to school, but parents are also concerned about health and safety. Our partners at Maine CDC and DHHS provided us with clear and prioritized requirements for health and safety. As school communities engage in the complex work of planning for the fall, School leaders, educators, and staff are facing some of the most daunting challenges imaginable. They will be counting on the support of local families and communities as they navigate this fast evolving and unpredictable situation. The team at DOE stands ready to support this work with guidance, technical assistance, and resources. And I guess, Governor, you can.
Unmuting. Thank you, Pender. Thank you, Commissioner Makin. I'm so proud of the work of this Department of Education, along with the Department of Health and Human Services and the Maine CDC, and the work you've done collaborating with school teachers, staff, parents, students, school officials, and public health experts, and community members across the state. Since the very beginning of this pandemic, we have tried so hard to maintain quality education to the best of our ability while keeping Maine children safe, and their parents and staff as well. We're here today because of those efforts. As the daughter of a woman who taught school for about 37 years in public schools in Maine, and as someone who brought up 5 daughters, all of whom attended and graduated from public schools in Maine, I'm very sensitive to the needs of families and faculties, especially in this extraordinary time. Let's go back to where we started in the spring of this year. As Pender Makin mentioned, 4 months ago, in light of the public health data which showed the pandemic starting to take hold in Maine, on March 15th, I recommended that all schools terminate in-classroom instruction. It was a difficult decision to make that recommendation, one that we did not take lightly. We knew that students, especially in rural communities without access to the internet, would be significantly impacted, and we don't want to lose the achievement level of those students. We knew that many parents would then struggle to work from home and help their kids with homework and schoolwork at the same time. We knew that teachers might be unable to monitor the health and well-being of their students the same way they do in school, in person, every day, in normal times. We also knew that while children seem less likely to suffer severe symptoms of COVID-19, they can still be carriers of the virus. They can transmit that disease to family members who are vulnerable, to school staff, to teachers, and to the community as a whole. So since that time, thanks to the vigilance of Maine people everywhere, we've managed to keep our COVID-19 numbers relatively low, especially compared to other states. Guided by public health data and an overriding mission to protect the safety of Maine people, we have gradually lifted restrictions and reopened many, many businesses, many sectors of our economy. But we know that for our economy to fully recover, parents need to be able to return to work fully and know that their children are safe at school or at childcare or both. We also know that lengthy time away from school can harm children, those who are at risk, especially before the pandemic, and it can interrupt their vital services, worsen their social isolation, make it harder for schools to identify risks to students' health and well-being. So our administration has been working to restore in-classroom education for Maine children wherever possible and provide essential support, funding, and public health guidance that is necessary to help promote a safe return to our classrooms for children, teachers, and staff. In the wake of the president's message that schools must reopen this fall or risk losing federal funding, regardless of the science, regardless of public health considerations, many teachers and parents contacted me in droves, afraid of the impact that this statement would have on Maine schools. But I want to be clear. Decisions about how best to return our kids to in-classroom schooling will be made in Maine, not in Washington, D.C. Individual school districts who know their own communities and their schools the best, and there are some 277 different school districts of a great variety of character and student body, 27 CTEs, almost 500 actual public schools that we're talking about across this state. The individual school districts know their communities and their schools best, and based on the latest public health conditions on the ground locally, they will choose for themselves, whether, when, and how they can resume in-class instruction. while following health and safety guidelines. I believe it's the state's role to set a basic health standard, excuse me, to provide public health guidance and provide as much financial assistance as possible for school systems. Pardon me. Good. To that end, the administration today is updating its framework for returning to classroom instruction. This document includes a series of health and safety protocols that schools will have to follow to protect the safety and well-being of students, staff, and families. These protocols were developed by public health experts. They include screening for symptoms, maintaining physical distancing, face coverings, hand hygiene, PPE indoors, and staying home if you're sick. The set of protocols will be standard across the state and will help schools maintain health requirements that will protect the safety of their students and staff in order to pursue in-person learning again. Now, to help them make the decision about whether and how to bring students back into the classroom, the Maine Department of Health and Human Services and the CDC have developed a three-level, three-tiered health advisory system to categorize counties based on a current public health risk in that county. We've broken it down into straightforward yellow, red, and green categories. The designation of red indicates the county has a high risk of COVID-19 spread and that in-classroom learning in schools should not be conducted. The designation of yellow indicates that the county has an elevated risk of COVID-19 spread and that hybrid learning models, which include in-classroom and remote learning, should be adopted. A designation of green suggests the county has a relatively low COVID-19 risk and that in-classroom learning can be adopted with a set of health and safety precautions, which we are also releasing today in detail. If a school administration, excuse me, a school administrative district within a green county cannot fully adhere to these precautions, they can choose to adopt a hybrid. The public health status of each county will be updated bi-weekly, starting July 31, and will be publicly available online at the DOE website. We also know that schools are going to be pressed for money to accommodate these health and safety measures. So to help them begin implementing these precautions and meet unbudgeted needs that are related to COVID-19, we'll provide startup funds of up to $165 million from Maine's remaining CARES Act funding. We will distribute these funds based on an equitable, weighted formula that the Maine Department of Education has developed in collaboration with school superintendents from across Maine. And next week, the Department of Education will inform each school system of its maximum allocation for this formula. I recognize that more assistance will be needed by schools, and I consider this funding to be an initial startup measure. And I'm hopeful that Congress will support additional funding to support safe operations for schools. Support for childcare is also important alongside support for schools. Today, we're also announcing an additional $8.4 million CARES Act funding on top of the $11 million we previously announced to childcare providers. This funding will support our youngest children, their working parents, and the dedicated providers and their staff. For the sake of Maine children, for their futures and for the livelihoods of Maine families, a safe return to classroom instruction must be our shared goal. Like many parents and teachers, I worry in particular about the children who are being left behind and about the inequities that have been exacerbated by this pandemic. But the goal of returning to in-classroom instruction cannot come at the expense of people's health and safety, regardless of what the Trump administration says. I want students, parents, and teachers and school staff to feel safe and confident in returning to their beloved schools. And I believe strongly that those decisions about returning to classrooms should be based on public health data, not on politics. I'll now turn things over to Dr. Shah, who will discuss the set of health and safety recommendations, as well as the public health metrics that will be used to determine a county's designation. And Commissioner Lambrew will then outline how this afternoon's announcement regarding childcare funds will help support Maine's working parents and youngest children. After that, we'll be happy to take questions. Dr. Shah?
Thank you very much, Governor Mills, and good afternoon, everyone. I'd like to provide a bit of a glimpse into the work that Maine CDC has been doing in close collaboration with Commissioner Makin and her entire team at the Department of Education. Our approach and our goal has been to reduce the risk of COVID-19 as educators get ready for the new school year. We do that in the same way that we have approached other issues during the COVID-19 pandemic, which is by following the best available science, all with the goal of keeping children safe as they return for the school year. I'd like to talk about two elements of that. The first are required health and safety measures for all schools. These include, among other things, symptom screening before coming to the school building, physical distancing within the facility itself, ensuring that children are provided with and are wearing face coverings, ensuring that children observe proper hand hygiene as they are at school, making sure that educators and school nurses and staff have proper personal protective equipment, and also finally making sure that children who are not feeling well stay home before returning to school in order to reduce the spread of illness. Now, each of these things, these 6 things, are things that I think all of us have already been doing at home throughout the pandemic. Now, we're asking for these things to be done in the school level as well. These are common sense measures rooted in science that, when taken together, can help reduce the risk of COVID-19 at the school level. The other thing that Maine CDC has been working closely with the Department of Education on is, as Governor Mills noted, providing a sense of what the potential risk is of COVID-19 at the county level. We've been assisting in this effort by providing and using our data analysis tools to help school districts everywhere in Maine have a sense of what the situation with respect to COVID-19 is at their county level. The goal of this effort is to provide schools and communities with a scientific understanding of the COVID-19 picture in their area. We accomplish this by looking at a number of metrics, including, for example, the number of new cases in the county over the last 2 weeks adjusted for population. We also take a look at what the various types of testing data are telling us about the COVID-19 situation in that county at that time. We're also taking a look at the percentage of individuals who are visiting their healthcare provider and talking about symptoms that they have that could potentially become COVID-19. All of those types of data, when taken together, help provide us an accurate and potentially even early look at the possibility that COVID-19 could be arriving in that county. We then use those data, as the governor noted, to try to index it to a system of green, yellow, and red with the corresponding measures taken by the school district level. This science-based approach, coupled with the required activities at the school level that I mentioned a moment ago, when taken together, can provide a strong foundation to reduce the risk of COVID-19 for our children. I'd like to now turn things over to Commissioner Lambrew.
Thank you, Dr. Shah. I am pleased to announce today that Governor Mills will invest more than $8 million from the federal coronavirus relief fund in childcare as part of her support for Maine's working families during the COVID-19 pandemic. Specifically, the Maine Department of Health and Human Services will pay more than 1,700 Maine child care providers for the extra costs and challenges of operating during the pandemic. Over 80% of Maine's child care providers are open, a testament to their commitment to health and safety precautions in partnership with the families they serve. This funding will further support recovery, relief, and accommodation of additional children. Through the funding announced today, center-based providers will each receive up to $9,200, and family-based providers will each receive up to $950. Additionally, in August, Child care centers will receive an additional $2,800, and family-based providers will receive an additional $550 from the remaining $2.8 million from the Federal CARES Act funding. These grants will focus on child care providers that are open and providing care by September 8th, 2020. Taken together, Maine will meet the Bipartisan Policy Center's recommendations for child care reopening and recovery. Still, child care providers face new operating costs due to the pandemic that will persist beyond reopening for increased staff, personal protective equipment, facility modifications, and cleaning. Congressional funding for sustainability and stability of affordable child care is needed. With that, I will turn it back over to Dr. Shah for questions.
Okay, well, thank you, Commissioner. Governor and Commissioners, we're going to turn to our colleagues in the media for questions. And today's first question goes to Rosalind Flaherty from News Center.
Hi, Dr. Shah, can you hear me?
Yep, go ahead, Rosalind.
For physical distancing, some classrooms are smaller and some class sizes have up to 30 kids. How is that going to work?
Sure. Commissioner Makin, do you want to start that off? Or I'm happy to.
Oh, no, sure. Well, it certainly presents a challenge, as you mentioned, and it will require smaller size groups. It will require schools to have to look into creative ways of making space in other areas in the school, or modifying the layout of classrooms, or even using larger areas with partitions to develop smaller spaces. There are so many different school buildings and capacities and facilities that it'll look different every place. And in some cases, it will mean a hybrid model is necessary so that some students won't be in school at the same time as other students.
Thanks, Rosalind. We're going to turn to Terry Stackhouse at WMTW.
Thank you, Dr. Shah. This question is for Governor Mills. It has to do with the $165 million in CARES Act funding for education. I believe it was last month the DOE initially asked for $325 million. The Economic Recovery Committee requested $300 million for education. And then I believe in today's statement that was released from the governor's office, some hopefulness was expressed that more federal aid will be made available. Governor Mills, if you could talk about how that $165 million number was reached, and what would happen if more federal funding is not made available.
If it's not made available. Thank you for the question, Terry. Frankly, this is initial. This is not the entire amount we would like to provide for education to accommodate public health and safety needs. And I apologize for the scratchy throat earlier. I should know better than to have potato chips for lunch before public speaking. But we feel this is the startup amount that needs to go out the door as quickly as possible to get schools ready in a physical sense for the fall semester. It's not the entire amount that we envision is necessary for education in general. We do hope that Congress will take action in the coming weeks. I understand there are at least 4 bills that are being taken very seriously in the U.S. Senate, that the president is looking at, that the federal officials are looking at, that I believe will receive favorable action in the Senate in the coming weeks. And we are hoping that a good part of that provides funding for education. Commissioner Makin can perhaps give you a better breakdown on what the 165 entails. Again, it's not everything that we're looking to spend on education. It's the initial funding.
So,
Commissioner Makin, if you wouldn't mind, I'm curious to know the initial spending priorities for that $165 million. I believe that a figure was released perhaps yesterday that up to 20% of public education staff members may need to either work remotely or cannot safely teach in person, requiring a need for temporary staff. Does that remain a top priority in terms of spending?
That does remain a top priority. However, that would be in the next, Okay, no, I'm not muted, sorry. That would be in our next ask. These, the figures are broken out not so much in prioritization of need, but rather chronology of need. Right now, in order for our schools to be ready to receive students and staff members safely in the fall in any numbers, they need to make this first significant and urgent investment in upgrading facilities, in maybe trading out large tables for group work for desks instead. There are so many pieces that have to happen. So this first installment and request reflects the needs that schools now have in this moment. And as we get toward fall, there will absolutely be many unbudgeted, unplanned for, and unanticipated expenses, including the cost of substitutes and consulting, and not consulting, but contracted services to support student learning and supervision.
Great, thank you. We're going to turn next to Isha at the BDN.
Hi, can you hear me?
Yep, go ahead, Isha.
Thank you. I have two questions today. The first one is about the health tiered system that you just talked about. I was wondering, since there can be variations in COVID cases and positivity rates within each county, will school districts that need it be able to get a further detailed assessment by town maybe or by region?
We're looking into that, Isha. We recognize that, of course, many of the counties in Maine are large, and there can be great amounts of variation between north and south, even within a county. So we're not taking a one-size-fits-all approach, certainly not at the state level and not at the county level either. So if there is something going on that might be potentially restricted to one area of the county that may not affect schooling in another part of the county, we will take that into account as we're working with school districts.
And maybe I can add too, you have to keep in mind that just because a school district has one town or three towns or five towns, it doesn't mean that all the staff or teachers or even all the students live in those same towns. They may commute back and forth from other parts of the county. So we are looking at, it's not a perfect system, but it is something that I think is reasonable and appropriate to look at counties in general. I am in a school district that has 10 towns, mostly in one county, but with bits and pieces of two other counties. So the reverse is also fair to say if one county is a hotbed or red zone and one county is green, we're going to have to look at accommodating those different dynamics.
Okay, thank you. And my second question is about the requirements, some of the, requirements about face coverings and social distancing. I was wondering if elementary and pre-K students, the younger students, will also be required to wear face coverings while at school?
So, go ahead, Dr. Shah, you can answer.
Sure. So the answer is, the bottom line answer is yes. The recommendation, or the requirement rather, is that children age 2 and above are required to wear a mask or a face covering that covers their nose and mouth while they're in school, obviously other than the time that they may be eating or getting a sip of water. We're going to turn next to Jennifer Mitchell at Maine Public.
Hi, can you hear me now? Great. So what is the situation then with PPE and testing for teachers, staff, students, et cetera? Is the department going to be helping with that? And does it seem likely that there's going to be a need for more actual rapid COVID testing this fall? And will people realistically be able to get those tests as people come into more contact and there are predictions of possible spikes and things like that? So PPE and testing.
So the Department of Education has already worked with MEMA and to order and procure for the schools the PPE that they're going to need. And those deliveries are already on their way. So we are taking care of that. And I think I would leave the testing questions for the doctor.
Sure. So testing, Jennifer, is something that we've been thinking through as it relates to how children can go back safely to school. Certainly, if a child has symptoms that may be consistent with COVID-19, one of their family members does, the recommendation is that they go visit their primary care doctor And if a child, of course, has symptoms, staying back from school is one of the first lines of defense. Right now, that's where we're focusing our efforts with respect to testing to make sure that any child who may have symptoms, or in this situation, any teacher who may have symptoms, can easily access testing. The swab and send sites that Commissioner Lambrew and I have talked about this past week will greatly facilitate the access to testing across the state, specifically for parents and teachers as they may be re-entering school.
Can I ask a quick follow-up here? One of the questions I did have was because, schools are such a local control issue and we have so many different districts. Is there also some sort of an enforcement piece to this? Because what we've seen over the summer, of course, is that some entire towns have sort of flouted regulations you can suggest, but is there an enforcement piece or are you just hoping everybody follows along?
Well, let me just say, we're not sending the police after any school teachers or superintendents who don't require 6 feet here, 3 feet there on a particular day in a particular classroom. That's not what this is about. These standards, though, have been developed by public health professionals and the rest by consensus, by discussing what could happen with all superintendents across the state, with members from school boards and Maine Education Association and others. We fully expect compliance because everybody shares the same concern here. We want to make schools available again. We don't want our kids to drop off the cliff of losing their achievement and increasing the achievement gaps that may already exist. We all want our kids to have the best education, the most robust education possible, and we want to keep our teachers and staff safe. So I think that this plan is a good balancing of those considerations. And I think that people will understand those considerations and agree with them. It'll be up to the school boards and the superintendents and staff and teachers to help explain the parameters of these checklists and protocols to the public in their school districts. I think people will generally come around to agreeing with them.
We're going to turn now to Owen Kingsley at WABI.
Yes, Dr. Shah. Just curious if there's any concern about what actions the state might recommend if an outbreak were to occur at a single school.
Sure. I'll start that and invite others. But we have certainly thought about that issue as we've been thinking through our approach. We've done so by studying the experience that other countries have had with respect to having children in school. I say that because it's important to note that we have been able to learn a great deal from the experience of a number of other countries across the globe that have already had children returning to school, or in some instances didn't have them away from school. Our approach right now with respect to a single case of COVID-19 will be a few things. The first is that the school nurse or other health official who supports that school has a designated point of contact within the Department of Education. That person, a school nurse herself, is the designated point of contact with the Maine CDC. We too have started and are working on developing protocols for how we will approach outbreak situations in schools. They're very similar to the protocols that folks have heard us talk about during these meetings over the past few months. Contact tracing, testing, making sure that children who are affected are minimizing the risk of affecting others. So we've got those protocols in place, as well as the communication chain from the school to the department over to Maine CDC. I think I was muted. I'm going to turn now to Rachel Ohm over at the Press Herald. Hey, Rachel. We're going to come back to Rachel in just a second while we turn to Amy Brown at WERU.
Thanks, Dr. Shah. One of you specified using PPE indoors. What about playground time and sports? Anybody?
This is Jeanne. I think what you'll see is, in addition to the framework that's on the Department of Education website, there is also additional information called public health guidance for pre-K through adult education that does begin to talk about those circumstances. So there's some more background, and it's mostly best practice for our schools that are in those documents. I would note that face coverings, as are described in these documents, are best practice. Our public health community has really come around the fact that to allow people to engage, especially children who often have a little bit more challenge respecting that 6-foot distancing, you really do need to ensure that they have those types of face coverings, or if that doesn't work, a face shield, to ensure that they can be around each other, be around their teachers, who often whom are older and do need that 6-foot distance to do so safely. So this requirement to have face coverings in school is really well grounded in the public health.
Okay. And the expecting compliance because it's the right thing to do model has not worked out anywhere, as evidenced by the outbreaks that we're seeing across the country. Do you have any kind of backup plan to make parents feel safe if there are kids in the school who are refusing to go along with this because their parents also refuse to go along with it?
Look, we're going to assume compliance. In March, when I recommended that in-classroom instruction terminate for now, everybody complied. It wasn't a mandate. It was a request and a recommendation, and every school district complied. I have no reason to believe that there won't be compliance with these new protocols as well.
Thanks, Amy. I'm going to turn back to Rachel Ohm at the Press Herald. Rachel, we're getting a fair amount of feedback on your line, but we'll check back in a moment. Well, we turn to Brad Rogers at WGME.
Hi, can you hear me okay?
Go ahead, Brad.
Okay, I have a couple of questions, actually. First, I know you've broken down the tiers by counties instead of community. Why not do it the other way around? Because you have, the map of communities. It seems like that would be what school districts will probably look for, is how are things in our community or in our school district. And you also said earlier, Dr. Shah, that we're going to take that into consideration, but the final decision is up to school boards, correct?
So, Brad, I'll take the very first question and then turn it over to others. This kind of goes to what the governor noted a moment ago. School districts, communities do not exist in isolation. They're all connected. Teachers can go from school, can live in one community, shop in another community, go to the doctor in a third community, go recreating in another, and then work in a fourth or fifth. And so the finer you break it down, the easier it is to fall into the assumption that what's not going on in my town can't affect me. And if we've learned anything with COVID-19, it's that something that's occurring in another county or in another town or in another part of the state can very easily appear. So there's the concern about going to a level of analysis that's too low, because we want to make sure we're casting a broad net because school districts are interconnected across the state. And then I'll go ahead, Commissioner Makin.
Sure. I just wanted to also add that information that you folks will be providing in terms of those levels of relative risk, those comprise one piece of information that school districts will be looking at as they determine whether it's safe and advisable to have students in the classroom. They could be in a low risk community or county, but not have the necessary required and additional guidelines for safety and health for everybody. So it's not going to be we will certainly be supporting districts in making those difficult decisions. And this is one tool that you've provided for us to support them with.
Okay, thanks. And just a quick question too for our sports director, Dave Eade. He wants to know about fall sports for schools where you feel it's not safe to have kids in the classroom, but what's that going to mean for high school sports?
So the MPA, Maine Principals Association, is working right now on their guidance for the high school level sports. And we have groups, subcommittees who are examining this issue for regular other school-based sports and activities that would involve interaction of students. And we're looking forward to support from also from the CDC and DHHS as we make those decisions going forward.
Okay, thank you.
Thanks, Brad. We're going to turn to Rachel Mann at ABC 7 next.
Hi, I'm just wondering if private schools will be receiving or eligible to receive any of that $165 million or any financial assistance or PP&E from the state if they do choose to return.
So the private schools have a few different options. They do have the PPP, Paycheck Protection Program funding, and they also, the 60/40 town academies who serve publicly funded students will also be receiving they will get an allocation like the other schools that are serving public students throughout the state.
And we're going to turn now to David Sharp at the AP.
Hi, yeah, this is Patrick Whittle standing in for David Sharp. Speaking of things that could be difficult, we were talking a moment ago about children and masks. As anyone who's ever put a hat on a child knows, getting an article of clothing to stay on the head or face of a child can be extraordinarily challenging. I'm curious what we're going to do to try to keep masks on faces, which is something that's been fairly challenging even for adults.
Well, we know that it has been done successfully in other places. We do have the luxury of having seen this unfold across the globe and across the nation. And we know that there are many young kids who do a great job wearing a face mask. We believe that the community could be very helpful to us right now, to all of the teachers and school administrators who are going to be working with students in the fall, to consider, please, modeling and supporting your children this summer as they're out in the community in practicing wearing those masks. So the first exposure to that isn't something that's being enforced in a classroom, but rather something that's part of our collective social interaction together as a community and a state who are together surviving a pandemic.
Thanks, Patrick. And I'm going to turn back to Rachel Ohm at the Press Herald for one last go.
Okay, can you hear me now?
Yes.
Okay, I apologize for my technical difficulties. My question is about the three-tiered system, and I'm wondering if you have more details about the metrics and whether you've identified specific numbers, like for a low designation, for example, like what number of cases would fall under a low designation or a high designation?
Sure, I'll start, and then Commissioner Lambrew, if there's anything I forget. Rachel, the metrics that we're going to be using it's a suite of them. It's not a single one, and we take them all in concert. As we have with other types of analysis of this sort, we take a holistic approach. There are many different ways to think about this analysis. The one that we're thinking through right now and that we're likely to adopt is one that takes a look at what the baseline level of COVID-19 is in a community at any one given time, and then looks for changes against that baseline. So it's less about X number of cases, because that could be different for different counties, and more about changes from that baseline that could signify a potential risk for students and thus necessitate a change from green to yellow up to red. That's how we're thinking about that right now. And again, we're taking a holistic view because there can be other elements of an outbreak or the disease that are not necessarily captured uniquely by numbers, but through other qualitative means as well. So, Commissioner Lambrew?
Sure, I'll just add three. One of which is we're really going to try to get more recent data by county. Our county data to date has been notive so from the start. So that's a little bit of what we're trying to work on right now. So we're going to be improving our data releases to try to get, for example, recent positivity rates by county and syndromic data by county, which doesn't exist now. So just note that's a little bit of our evolution here on our website to produce more information for the public generally that will be of use here. But the second thing I'll say is the yellow, red, green designations are for our colleagues in the schools. They're not about restaurants or other reopening. It is as simple as follows. Green is the set of conditions where we think in-class learning can happen if the schools are ready without restrictions. We will go to yellow if we indeed think there's a challenge in bringing as many children into a school as might otherwise cause some sort of level of transmission. So we would recommend yellow when we think that there should be fewer people in schools because of what's going on in the community. And red is when we really think there's something so significant that is unsafe to do in school learning. We decided, working with the Department of Education, rather than doing different levels of checklists and readiness, all schools would use the recommendations that Department of Education is doing no matter what, and we would use these green, yellow, and red classifications to figure the number of people in those schools. So we're calibrating these different designations specifically for the Department of Education for this purpose.
I'll just add on top of what Commissioner Lambrew noted, Rachel, these data that we're looking at will also be posted on the website as well. So we'll be sharing the data that we ourselves are looking at as we are going through this process so that everyone can see what we're seeing as well. Governor and Commissioners, that was the last question. So Governor Mills, can I turn it back over to you?
Sure, thank you very much. Barring any other closing comments, I'm looking through some of the letters I've gotten from kids. You know, we always do this. So many kids have written saying they're bored at home, they want to see their friends, they want to have play dates again. And one of them wrote and said, "We should go back to school. This is my last year of recess. People are thinking it is the end of the world. No, it is not. I want to go back to school." We don't want Kara to miss recess again. Last year of recess, for goodness sakes. But we've had thousands of comments from parents, children, faculty, staff, concerned citizens about this major issue of getting schools opened again for in-person, in-classroom instruction. It's a really important goal. We want to do it. We want to allow local districts to do it safely and give them the proper guidance and the funding to get started up with this, with reopening the schools. So I'm pleased at the effort we've been making. I know there'll be questions and there'll be Monday morning quarterbacking and there'll be people with various complaints and questions and concerns. We're doing the best we can. There's never been a playbook for this pandemic, but with great people like Commissioner Makin and Commissioner Lambrew and Dr. Shah on board, I think we've got the best team in America. We're going to do everything we can to get Kara and Wayne and Ian and Sadie and Michelle back to school. Thank you very much for listening.